Homeopathic Medication Part 12. A review conducted in 2010 of all the pertinent studies of best evidence produced by Cochrane collaboration concluded that the most reliable evidence that produced by Cochrane reviews falls to demonstrate the homeopathic medicines have effects beyond placebo. In 2009, the United Kingdom's House of Commons Science and Technology Committee concluded that there was no compelling evidence of effect other than placebo. The Australian National Health and Medical Research Council completed a comprehensive review of the effectiveness of homeopathic preparation in 2015, in which it concluded that there were no health conditions for which there was reliable evidence that homeopathy was effective. The European Academy's Science Advisory Council EASAC published its official analysis in 2017, finding a lack of evidence that homeopathic products are effective and raising concerns about quality control. Contrast, a 2011 book was published. In contrast, a 2011 book was published, purposely financed by the Swiss government, that concluded that homeopathy was effective and cost efficient. Although hailed by the proponents as proof that homeopathy works, it was found to be scientifically, logically, and ethically flawed, with most authors having a conflict of interest. The Swiss Federal Office of Public Health later released a statement saying the book was published without the consent of the Swiss government. Meta analysis essential tools to summarize the evidence of therapeutic efficacy and systematic reviews have found that the methodological quality in the majority of randomized trials in homeopathy have shortcomings and that such trials were generally of lower quality than the trials of the conventional medicines. A major issue has been publication bias, where positive results are more likely to be published in journals. This has been particularly marked in alternative medicine journals, where few of the published articles, just 5% during the year 2000, tend to report null results. A systematic review of the available systematic reviews confirmed in 2002 that higher quality trials tended to have less positive results and found no convincing evidence that any homeopathic preparation exerts clinical effects different from placebo. The same conclusion was also reached in 2005 in meta analysis published in the Lancet 2017 systematic review, and the meta analysis found that the most reliable evidence did not support the effectiveness of non individualized homeopathy. Health organizations, including the UK's National Health Service, the American Medical Association, and the FASEB, and the National Health and Medical Research Council of Australia, have issued statements saying that there is no good quality evidence that homeopathy is effective as a treatment for any health condition. In 2009, World Health Organization official Mario Reveligion criticized the use of homeopathy to treat tuberculosis. Similarly, another WHO spokesperson argued that there was no evidence of homeopathy would be an effective treatment for diarrhea. They warned against the use of homeopathy for serious conditions such as depression, HIV, and malaria. The American College of Medical Toxicology and the American Academy of Clinical Toxicology recommended that no one use homeopathic treatment for disease or as a preventive health measure. These organizations report that no evidence exists that homeopathic treatment is effective, but that there is evidence that using these treatments produce harms and can bring indirect health risk by delaying conventional treatment.